Good evening. Today, we will be presenting comprehensive sex education for parents of pubescent youth.
Hi, I'm Bella Fernandez Thompson.
I'm Angelica Gomez.
I'm Samuel Gonzalez.
I'm Andrea Ramirez.
And I'm Estefania Romo.
Our first program goal is parents will gain knowledge of the health risks associated with unprotected sex. Learning objectives. Number 1, participants will define one physical risk related to unprotected sex. Learning objective number 2, participants will define one emotional risk related to unprotected sex. So today, youth engage in sexual risk behaviors. Engaging in risky sexual behaviors can lead to HIV infection, sexually transmitted diseases, and unintended pregnancy among youth. A couple of diseases and related conditions include bacterial vaginosis, chlamydia, gonorrhea, genital herpes, HIV/AIDS and STDs, pelvic inflammatory disease, syphilis, trichomoniasis, and other diseases and conditions. One thing to note is that abstinence from vaginal, anal, and oral intercourse is the only 100% effective way to prevent HIV, other STDs, and pregnancy. The correct and consistent use of male latex condoms can reduce the risk of STI transmission, including HIV infection. However, no protective method is 100% effective, and condom use cannot guarantee absolute protection against STI or pregnancy. The following are your most common sexually transmitted infections, which include chlamydia, and this often doesn't cause symptoms, so people may not know they have it, which is quite dangerous for youth because they're not familiar with it and they won't know that they have it until it's too late. Gonorrhea, the bacteria that cause gonorrhea can infect the genital tract, mouth, or anus. You have genital herpes, and this can cause sores on your genital or rectal area, buttocks, and thighs. You can get it from having vaginal, anal, or oral sex with someone who has it. There's also pubic lice, which is also known as crabs, which are tiny insects which usually live in the pubic or genital area of humans. HPV, they can cause warts on different parts of your body, and there are more than 200 types of them. They can also spread through other intimate skin-to-skin contact. Syphilis. The early stage of syphilis usually causes a single, small, painless sore. Sometimes it causes swelling in nearby lymph nodes. And the last one is trichomoniasis, a sexually transmitted disease caused by a parasite. It spreads from person to person during sex, and many people do not have any symptoms. This next slide covers the topic of HIV and AIDS. And many ask, how is HIV or AIDS transmitted? One of the ways, which we're focusing on today, is sexual contact. HIV is spread most commonly by sexual contact with an infected partner. The virus enters the body through the lining of the vagina, vulva, penis, rectum, or mouth during sexual activity. Today, condom use is down. Condom use among sexually active students decreased from 60% in 2011 to 52% in 2021. And this is a serious health risk for HIV and STIs. It is important that youth today know that there is many resources out there to get tested. And even if it's just one time that you are involved in a sexual, in a sexual involvement, that you seek testing. And it's easy, it's free, it's confidential, and it's recommended.
So now we're going to be talking about adolescent pregnancy. As of 2019, adolescents aged 15 to 19 years in low and middle income countries had an estimated 21 million pregnancies each year, which approximately 50% were unintended and which resulted in an estimated 12 million births. Based on 2019 data, 55% of unintended pregnancies among adolescent girls aged 15 to 19 end in abortions, which are often unsafe. Adolescent mothers face higher risk of eclampsia, endometritis, and systemic infections than women aged 20 to 24 years. Babies of adolescent mothers face higher risks of low birth weight, preterm birth, and severe neonatal conditions, which means that they can end up in the ICU for a very long time. Their brain won't be fully developed. There can be other health problems with this. So, unsafe abortion. Every year worldwide, about 42 million women with unintended pregnancies choose abortion, and nearly half of these procedures, 20 million, are unsafe. Around 68,000 women die of unsafe abortion annually, making it one of the leading causes of maternal mortality. Of the women who survive unsafe abortions, 5 million will suffer long-term health complications. That being said, these long-term health complications can include complete abortion, which can be a failure to remove or expel all pregnancy tissues from the uterus, hemorrhaging, which is heavy bleeding, infections in the body, urine perforation, which is caused when the uterus is pierced with a sharp object, and also damage of the genital tract and internal organs as a consequence of inserting dangerous objects into the vagina or anus. So women and healthcare providers need to be educated about contraception and the ability of legal and safe abortion, and women need better access to safe abortion and post-abortion services. Otherwise, desperate women will continue having these unsafe abortions, and they'll continue to have the risk of death or having a high risk abortion. So risks of unprotected sex. This means that having vaginal or anal sex without a condom, you are more likely to get HIV and other sexually transmitted diseases. Bodily fluids like blood and semen pass from you to your partner during sex. Parents are encouraged to advise their adolescents that if they have a partner with HIV or STD, they can pass the virus or infection on to you, even if they don't know it. This is why it is essential to talk to your adolescent and tell them that to get tested if they are sexually active.
So, some emotional risks for individuals engaging in sexual activities can trigger emotional response that can impact their overall mental health. These feelings may manifest as guilt, shame, or anxiety. Others may experience a range of emotions following sexual activities, such as self-doubt, remorse, excitement, or joy. These are some emotional risks related to unprotected sex. So regret. Many adolescents admit to feeling instant regret after engaging in premature sex. Some girls are quick to say yes to having sex with the boy they like. Later on, they become devastated when they learn that their crush has no feelings for them or that they like some other girls too. This kind of scenario not only makes them regret getting intimate, but it may also make them get stressed over losing the boy. For guilt, feeling of guilt can easily wash over a minor, especially when they have casual sex, whether they had sex due to peer pressure or out of curiosity. It haunts a teen when they know deep down that they did something morally wrong. They also lose their self-confidence. If a minor finds out that they are straying from their family values or have contracted an STI, they may blame themselves for not being careful enough to avoid the oh my God, sorry. They may feel embarrassed about the situation and avoid interacting with others. At this point, they may lose their self-confidence and self-esteem. This is a continuation. So apprehensive. Adolescents experience an incredible amount of worries when they engage in sex. This is because there's always a risk they might get pregnant or contract an STI when they engage in unprotected sex. Depression and suicide. While some teens may not move on swiftly after breaking up with their sexual partners, others do not handle the situation as casually. Premature sex can have negative psychological effects. The emotional dangers or premature sex among youth are real and ongoing. Having sexual relationships may appear to be casual thing at first, but after some time they may realize that these relationships can take negative toll on their emotional well-being.
The second part of our workshop includes program goal number 2. Parents will gain knowledge on effective communication strategies to discuss the health risk of unprotected sex with their children. Learning objective number 1, participants will define one element related to active listening. Learning objective number 2, participants will incorporate resources within 1 month of the workshop.
Okay, so we know these conversations are difficult to have with your children, no matter what their age, but they are crucial. And active listening serves as a great communication strategy to aid you. So what is active listening? Active listening is where you make a conscious effort to hear what another person is saying and their complete message. It involves 5 key elements, and it's important because you'll be able to avoid conflict and misunderstandings and have an overall better understanding of each other and feel like you communicated more effectively. So the 5 key elements of active listening include paying attention. Give the speaker your undivided attention and acknowledge the message. Recognize that nonverbal communication, like eye contact and gestures, also speaks loudly. The second one is show them that you are listening. Use your own body language and gestures to know that you are engaged. Make sure that your body is facing them and your eyes are facing them as well. Also provide feedback. You can do this by reflecting on what is being said through paraphrasing, asking more questions to clarify, and summarizing comments periodically. We also have deferred judgment, which is very important with teens, and it allows you to continue to build trust with them. What you do is you allow the speaker to finish their point and don't interrupt with any counter arguments or any negative remarks. The last one would be respond appropriately. Be candid, open, and honest in your responses. Assert your opinions respectfully and treat the other person in a way that you think they would want to be treated. And also allow them to ask you questions. And if you don't know the answer, you can say that you'll figure it out together.
Some communication tools that you can use when speaking with your children are providing books for them. There are many that are age appropriate for children when learning about sex education. There's also videos and movies. Parent-child communication programs are also another option where it allows the children to be in a safe environment and the parents are able to learn what they need to tell their children. And then also allowing children to have one-on-one time with their doctors during doctor's appointments so they can ask their pediatrician or doctor any questions that they may have with the parent not in the room. The first book option is It's Perfectly Normal, Changing Bodies, Growing Up, Sex, and Sexual Health by Robbie B. Harris. The second option is the What's Happening to My Body book for boys, a growing up guide for parents and son And the third options is the What's Happening to My Body book for girls, a growing up guide for parents and daughters. And both of those are by Linda Medaris and Martin Anderson. We have also provided 2 movie options that you can watch with your child or just provide for them to watch on their own. And the first one is Teen Sexuality in a Culture of Confusion. And the second one is Sex Education. How did you learn about sex? So here's one of the importance of parent-child communication programs is 24% of female teens parents and 38% of males teen parents have never spoken with their children regarding abstinence or methods of birth control.
This is a list of our references. And that concludes our presentation. Thank you so much.